Hi, I'm Dr. Sylvester, and I want to talk to you a little bit about why you might want to consider our clinic for a diabetic foot ulcer. Diabetic foot ulcers are life-altering events. The prognosis of a patient that has a diabetic foot ulcer is poor at best. I mean, that's a signal that a lot of things are wrong. Their nerve function's bad. The patient's deformity, there's usually a deformity associated with it. Sometimes there's a vascular component. So there's a lot of very difficult things that occur, that have to occur prior to getting the diabetic foot ulcer, things that are hard on the patient. So if you have a diabetic foot ulcer, all those need to be adequately evaluated. The problem with most, like if you, for example, in a wound care center, they treat the wound. They look at the wound and think, oh, well, that's the problem. I'm going to treat this wound. So they'll spend $1,000 on a wound care product to put on the wound to try and get that to heal. Or they'll tell the patient to stay off the foot, which is, it's okay. I mean, that's right. But it's difficult to do forever. And then what happens if the same structure that caused the ulcer in the first place is there, then it is, and after the ulcer healed, the ulcer has a very high recurrence rate. That's clinically proven. I think 70% of diabetic foot ulcers recur in the first year. There's two things that are required for an ulcer, a traditional diabetic foot ulcer. One is numbness, two is some deformity. So at the Next Step Foot and Ankle Clinic, we try to address the why you have the foot ulcer, not just the ulcer itself. It's very common. We see patients that have had ulcers for 4 or 5 years. We address the pressure problem or the neurologic problem if it's addressable. And then the ulcer heals almost miraculously. It's like the ulcer heals itself. You don't have to spend a ton of money on the wound if you fix the why the ulcer there occurred in the first place. There's risk with that kind of approach, but we found that in our practice, patients really managing a foot ulcer conservatively by just treating the wound is usually a recipe for disaster. You're basically dooming the patient to constant recurrent, if not ulcers, at least pressure points, shoe gear, modifications, living in abject terror the rest of their lives because they've got a place on their foot that any moment now is going to break down again. So by taking the pressure off the wounds with surgery, whether that be musculoskeletal or tendon balancing or whatever it is, hammer toe procedures, whatever it takes, then the problem goes away and it's out of the patient's life. So that's our goal with Next Step Foot and Ankle Clinics, not just heal the wound, but heal the problem that caused the wound in the first place. So give us a call if you have a foot ulcer and you need another opinion about that. Thanks.